Welcome to this explainer. Today, we're totally demystifying hypertension. Now, you probably already know the clinical basics of high blood pressure, right? But to really grasp how different medications relieve all that cardiovascular stress, it actually helps to think of it like plumbing. Seriously, instead of getting lost in the microscopic biology right out of the gate, let's just picture your cardiovascular system as this giant, complex network of pipes, all driven by one central pump. We're going to open up the plumber's toolbox, so to speak, and check out the exact pharmacological tools doctors use to fix the system and get those internal pressures back to a safe, healthy level.
Okay, so let's set the baseline. Hypertension basically just means the pipes in your body are under way too much persistent stress. The pressure of the blood pushing against your vessel walls, it's just consistently too high. And this creates a really turbulent environment that, over decades, literally wears down the structural integrity of your arteries. It's not great. So to fix this, doctors don't just grab a generic hammer. No, they use highly specific medications that lower the pressure through entirely different mechanical pathways, and it all depends heavily on your unique health factors.
So, you might be wondering, with all these pharmaceutical options out there, which drug is the best? Like, what's the ultimate fix? Well, here's the truth. There is no single magic pill. Treating high blood pressure isn't a one-size-fits-all kind of deal. The stakes of picking the wrong medication are actually pretty high. I mean, a drug that works absolute miracles for one person's system might trigger severe side effects in someone else. The best drug entirely depends on matching the right medical tool to the unique, specific setup of the house, or the patient, we're trying to stabilize.
So, here is our agenda for today. First, we'll look at the high blood pressure puzzle. Then, we'll dive into the four main classes of drugs: ACE inhibitors for relaxing blood vessels, ARBs as the cough-free alternative, calcium channel blockers for muscle relaxation, and diuretics, the water pills. Finally, we'll wrap up by looking at how doctors go about finding the best treatment.
Let's kick things off with Section 1, the high blood pressure puzzle. Which brings us right to Section 2, ACE inhibitors, focusing on relaxing those blood vessels.
All right, let's explore our first major tool. ACE inhibitors act as incredibly effective pipe relaxers. How? Well, they block your body from producing a specific chemical called angiotensin II. Think of angiotensin II like this harsh, blaring alarm signal that tells your blood vessels to clench up and narrow. By completely blocking that signal's production, your vessels just naturally relax, they open up, and bam, the systemic pressure drops. You might actually recognize some of the common ones in the medical world: lisinopril, enalapril, and ramipril. Notice a pattern there? Yep, they all end in pril. This naming convention is basically a universal cheat code for medical professionals everywhere to instantly know exactly how the drug works, no matter what brand name is on the bottle.
So why exactly would a doctor reach for a pril? Well, beyond just lowering blood pressure, they offer some truly amazing secondary benefits. For example, they are absolute lifesavers for protecting the kidneys, especially if a patient is dealing with diabetes. They do this by specifically lowering the micropressure inside the kidney's tiny, delicate filtering units. They're also super important if you're managing heart failure or bouncing back from a heart attack because they reduce the overall workload on your healing heart muscle. But there's always a catch. You've got to watch out for side effects. The most infamous one is this persistent, annoying dry cough. That happens because blocking the ACE enzyme accidentally causes a protein called bradykinin to build up and literally tickle your lungs. They can also spike your potassium levels, and in really rare cases, cause a dangerous swelling known as angioedema.
Moving right along to Section 3, ARBs, the cough-free alternative.
So let's say that nagging dry cough from the ACE inhibitor is just driving you crazy. Well, doctors actually have a brilliant fallback plan. The sibling rivalry between these two drug classes comes down to a really subtle but profoundly important mechanical difference. While ACE inhibitors stop the actual production of angiotensin II, ARBs take a different route. They simply block the receptors where the chemical tries to attach. It's kind of like, imagine someone trying to unlock your front door, but you've gone and changed all the locks. The chemical is still floating around outside, but it absolutely cannot deliver its message to narrow those blood vessels. The beautiful result here? ARBs totally spare you from that lung-tickling bradykinin buildup. You get no cough, and the drug remains extremely well tolerated.
Because they are so incredibly effective and people tolerate them so well, doctors prescribe these specific ARB medications all the time. And just like before, we've got a handy naming pattern. We're talking losartan, telmisartan, and valsartan. If it ends in sartan, you're looking at an ARB. They are a fantastic, super comfortable alternative to keep your internal plumbing nice and relaxed without the whole respiratory irritation thing.
All right, on to Section 4, calcium channel blockers, or as I like to call them, the muscle relaxers.
Now we are stepping completely away from the angiotensin system to explore these specific muscle relaxers. This third class of medications gets right to work on the actual physical structural material of your blood vessel walls. Here's the deal. Smooth muscle cells absolutely need a constant influx of calcium to contract and physically tighten up. So by blocking calcium from entering those specific cells, calcium channel blockers literally stop the smooth muscle from contracting. They force the vessels to stay perfectly dilated and relaxed. When we talk about the heavy hitters in this category, you'll see names like amlodine, nefidine, and diltiazem. And a quick side note here, there's a bit of a clinical split. Amlodine and nefidine strictly focus on dilating your peripheral blood vessels, but others, like diltiazem, actually go a step further. They specifically help slow the electrical conduction of the heart itself, giving that central pump a much-needed break.
Now, while calcium channel blockers are exceptionally good at their main job of relaxing those blood vessel muscles, they definitely bring their own unique physiological quirks to the table. You really have to keep an eye out for side effects like severe headaches, facial flushing, or significantly swollen ankles. And that ankle swelling, it's basically just gravity doing its thing. The blood vessels are opened up so effectively that fluid just easily pools down into your legs and feet over the course of the day. It's a direct mechanical trade-off for getting that systemic blood pressure dramatically improved.
Next up is Section 5, diuretics, commonly known as the water pills. This is our fourth and final tool, and it tackles the high-pressure problem from a totally different angle. If the previous medications we talked about were all about expanding the physical pipes to handle the flow, diuretics are all about actively reducing the total fluid volume inside those pipes. Think of it literally like bailing water out of a flooded, overpressurized boat. Your kidneys basically act as the master filtration system for your house. These specific water pills, most commonly hydrochlorothiazide, chlorothalidone, and furosemide, command your kidneys to aggressively dump sodium straight into your urine. And thanks to the laws of osmosis, wherever sodium goes, water naturally follows. By flushing out that extra salt, the water goes right along with it, your total blood volume physically drops, and your systemic pressure goes down right alongside it.
Because diuretics physically remove volume from your cardiovascular system, they are especially useful for older adults whose vessels might have naturally stiffened up a bit over the years. They're also highly effective for patients managing the fluid buildup of heart failure, or people who specifically suffer from salt-sensitive hypertension. But as you can probably guess, because they alter your body's fluid balance so aggressively, you really have to watch out for dehydration, and understandably, some very frequent trips to the bathroom. On top of that, doctors have to monitor for a dangerous drop in potassium levels. When your kidneys are busy rapidly flushing out all that sodium and water, vital potassium gets swept out into the urine right alongside it. So careful monitoring by a physician is an absolute must.
And finally, we arrive at Section 6, finding the best treatment.
Okay, let's bring all this pharmacology together to see how your doctor actually evaluates all the variables and selects the right tool for you. Like we established early on, there is absolutely no magic pill. Your customized treatment is completely dictated by your unique individual parameters. We're talking your age, kidney function, diabetic status, any pre-existing heart disease, pregnancy, and of course, your unique tolerance to side effects. Let's walk through a hypothetical scenario. Imagine a 60-year-old patient who was recently diagnosed with diabetes. A doctor isn't just going to blindly pick a drug from the toolbox. Because of the diabetes, an ACE inhibitor might be the very first choice, specifically to safeguard those delicate kidney filtering units we talked about earlier. On the flip side, if you've got an older patient with isolated systolic hypertension and maybe some swollen ankles, a diuretic might be the absolute perfect starting point, while they'd actively avoid those calcium channel blockers. It just goes to show you that managing hypertension is highly dynamic. It is an intricately tailored approach designed exactly for your body's specific structural needs.
So, we've seen how brilliantly these four distinct drug classes, ACE inhibitors, ARBs, calcium channel blockers, and diuretics, target hypertension from completely different physiological angles. As we wrap up this explainer, I want to leave you with a thought. With modern treatments relying so heavily on your unique variables right now, what could the future of highly personalized medicine look like for you? Consider how your own unique health profile, perhaps even down to your specific genetic markers, will shape the incredibly targeted medical tools of tomorrow. It's fascinating stuff. Thank you so much for joining me, and keep exploring.